Hi, good afternoon, everybody. I'm Dr. Glenn Corneal, Acting Medical Officer of Health for Timiskaming District. Thank you for joining me today. On the line will be the press, but we are also live streaming this to our Facebook page to help keep the community informed. As per the press release that went out a few hours ago, Timiskaming District has our first positive confirmed case of COVID-19. This is not at all surprising. It was a matter of if it was going to happen, when it was going to happen, not if. And as I will underline later, nothing changes in the direction with respect to the fact that all of us in the province should continue to maintain distancing and self-isolating as indicated. So this first case for our district is a man in his 30s. He was notified on March 18th that he was a close contact of a COVID-19 positive person. This close contact was a returning traveler from the United States. This contact was made while our client was outside of our district. On March 18th, the client was received a call from Public Health, and as he was having mild symptoms of a cough at the time, he reached out for direction, and he was able to be swabbed at a local primary care facility in the parking lot. He has strictly self-isolated since that time. It's important to note that everything was done correctly in this case. For example, as soon as the client was notified of contact with a confirmed case, he called ahead to seek guidance. Primary care was ready to do the testing, and it was done with full and proper personal protective equipment. The patient then self-isolated and received a call this morning from us that his case was in fact positive. It's important to note in this case as well that Timiskaming Health Unit has already been able to confirm that the patient only had contact with immediate family from the time of arrival in the district through to today, and we've already essentially completed contact tracing in this case. So to reassure the public, if you have not been called by Timiskaming Health Unit, you have not been in contact with this case. I'd also like to underline, I know people will be keen to know more specific details of this in any positive case, but patient confidentiality is paramount in any disease of public health significance. The government provides very clear guidance on what information can be released publicly. Plus, it's very important to note, specific details do not change our direction to the public. As we have one case or 5 cases or whatever number of cases, the direction is going to be the same. If you've been in close contact with a confirmed case, you will be contacted by Public Health. Otherwise, the advice continues to be the same important messaging. If you've traveled outside of Canada, you have to self-isolate for 14 days. If you have concern of COVID-19, there is now an Ontario self-assessment tool which we request be completed before you reach out to either telehealth or THU with respect to guidance for testing. The provincial government website has this Ontario self-assessment tool, and THU has a link to it as well. And this will help provide you guidance if you need to be assessed or not. Everyone should continue to follow provincial and federal guidance and be focused on maintaining distancing and staying home if you're sick, as we are all trying so hard to flatten the curve and trying to prevent overloading of our healthcare system by COVID-19. Also, please continue to follow the Timiskaming Health Unit website. We are now, for the last few days, posting the number of cases in our district, both how many cases are positive, how many are negative, and how many tests are pending. As the cases increase, even if we have another case in a couple of days, we will not necessarily be doing a press release. And again, all health units are following these measures. It'll depend on a case-by-case basis. I will now open it up to questions.
On the phone lines, are there any questions for Dr. Corneal?
Hi, it's Martha Dillman with CBC in Sudbury. I'm on your website now and looking at the numbers of the testing in your region. I see to date you've tested almost 89 people, and you're still waiting for 38 test results to come back. I'm just wondering how many days it's taking from when people get tested to when you get results, and if that's adding a challenge for public health officials to get this information out in a timely manner to people.
So Yes, it's a challenge. Part of our challenge is there's an extra day of transport time, at least one day, sometimes a little bit longer over weekends, to get the tests down to Toronto. I've just come from a meeting on this. The government and the testing PHO labs are working very hard to increase their capacity. They're also working on different measures, for example, to get hospitals up and running to do testing, etc. So it does have some impact. That being said, all cases who are swabbed are being told to closely self-isolate. So while there's a little bit more of a delay right now as they're catching up with how many swabs are being done in the province, the direction does not change. It's if you're swabbed, you have to self-isolate until we can get back to you on the results. The challenge, of course, for people is once they've been swabbed, there is a little bit of an extra delay at the present time to get the results, which we understand is hard on people, but the measures stay the same.
Are you able to give me a sense on average how many days it's taking to get the results from when someone is tested?
I don't know the exact number. There is a range. We've also gotten a bunch of negatives today, so I don't have that exact answer for you.
Another question from the phone?
Hi, so I realize you say like you can't give out certain information, but are we able to know what town it was in?
No, we're not. Especially in smaller districts, it's very important that we maintain patient confidentiality, so I will not have more information as to the location in our district.
Okay, thank you.
Thanks.
It's Diane Johnston at the Timiskaming Speaker in New Liskeard. What is the follow-up with anybody who would test positive and be isolating at home? Is the health unit in touch with these people every day?
So that will depend on the circumstances a little bit, Diane. We will be in contact with them obviously to let them know about positive cases. We are also contacting all negative cases. And then it's on a case-by-case basis. We will be providing direction to positive cases as when they can stop self-isolating. The level of contact we will be making with them also depends on how sick they are. For this case, for example, the patient is quite well and just had mild symptoms. If the symptoms are more intense, there might be more direct contact to help give them direction as to when they should seek medical attention. And so we are in contact throughout the time. It's just not always textbook as for each case.
Thank you. And one more question. Given that we do have a positive case now, this could raise the level of local anxiety. More people might want to be assessed. Is any consideration being given to setting up a separate assessment center?
So we, in the district, have gotten the provincial okay to be ready to execute a regional assessment center when we're ready. At the present time, this has been closely watched by myself, our hospital colleagues, and the regional team. At the present time, though, it's important to underline, just because we have a positive case in the district, this does not change the indication for testing. The testing guidelines have not changed, even though they may at any day now. They continue to be, if you are symptomatic and have been returned from travel outside of Canada within 14 days, that's likely an indication for testing, though there's a little bit of gray zone as to what the symptoms are. The symptoms of concern are usually fever or cough or shortness of breath. If you have a close contact with a confirmed case and you are symptomatic, that's another indication to test. Then there's testing criteria for sick people in hospital. So even though there's a positive case in the district, it has not changed who should be tested. We're really keen to try to underline that message to the population. In this case, we've already contacted most of the people, I believe all of the people who've been in direct contact with this patient. So there shouldn't be a flood, because if you haven't heard from public health, you've not been in direct contact with this confirmed case.
Thank you.
Doctor, it's Brett, Sheriff, Northern News and Kirk Lines.
Hi.
Go ahead.
Yeah, I just wanted to ask you, can you say where he was? You said he was out of the district. Are you allowed to say where he was?
No, again, in the guidance we got on this, because of patient confidentiality, all we can say is that the contact with another confirmed case was outside of our district.
And that contact, the person that they contacted, they were in the state, you were saying?
That's right. The index case was travel back from the US, and that's how our client came in contact with somebody who was tested positive for COVID.
Okay, thank you.
And again, that just underlines the importance. If you've traveled back from anywhere outside of Canada, please stay home for those 14 days.
And again, you said he only had contact with immediate family?
Since he's been in our district, that's correct. He's only been in contact with family. Yep.
Okay, great.
Any more questions on the phone line?
No?
Okay, thanks everybody for your interest. We'll wrap up here. Stay safe, continue to follow the direction from health units and the province and the government, and stay well.
Thank you very much.
Thank you.
Thanks.